Students, in this lecture, we will discuss the different types of arrhythmia. Before going into the detail of the type of the arrhythmias, you must know that what is arrhythmia. Arrhythmia is actually a problem with the rate or the rhythm of the heartbeat. So, coming towards the types, you know that arrhythmia is basically caused by the abnormalities in the impulse formation and the conduction within the heart. Now, what are the types of arrhythmia? There are basically three different types of arrhythmia which we will discuss in this lecture. Now, the first type is atrial arrhythmia, which is further divided into atrial flutter and atrial fibrillation. Now, what is difference between flutter and fibrillation? Basically, the fibrillation is this fibrillation is the atria in which the atria beats irregularly. While in case of the flutter, there is atrial beat that is regular but faster than the normal, that is faster than the ventricles. Now coming towards the second type, that is supraventricular tachycardia, that is also of two types, that is AV nodal re-entry and acute supraventricular tachycardia. Now, what is the difference between both terms? When we talk about the re-entry, AV nodal re-entry, atrioventricular nodal re-entry, re-entrant tachycardia, then it means there is an extra pathway which is involved in your impulse. There is formation of one or more extra electrical pathway, probably due to the blockage of the normal pathway and near the AV node, or there is the loop back of the impulse on itself. There may be formation of a short circuit, probably due to any kind of blockage. Then talking about the supraventricular tachycardia, this is the tachycardia which is basically above the bundle of His. Now coming towards the third type, that is the ventricular tachycardia. These is of two type, acute ventricular tachycardia and the ventricular fibrillation. Now, what is the difference between the both terms? In ventricular tachycardia, actually there is fast, word is fast. There is fast and abnormal heart rate in your heart's lower chamber. It is basically starting in the lower chambers of your heart. Basically, it is starting in the ventricles. Now, what about the fibrillation? As already discussed, fibrillation is actually the term that is associated with the irregular heartbeat. So, in this type of the system, there is uncontrolled irregular heartbeat. So, students, this was all about the three types of the arrhythmias.